Hello, everyone. Very good afternoon. We would start our session today. Uh, Thank you so much, everybody, for joining in for today's session. My warm greetings to everybody who joined the call today. And I believe there are a few more people who would be joining in the course of time. So my name is Varun, and I'm the Director of Hospital Success at Medlearn. Medlearn team is excited to connect with you all once again in its popular series of industry expert sessions where we ensure that healthcare professionals get an opportunity to interact with seasoned leaders from healthcare. And we have a very interesting speaker today with us. So we have been receiving a lot of suggestions on what Medlearn is planning on cancer awareness, and hence we decided on getting an expert who can aware us about cancer, the complexities, and what's the lifestyle modification that we need to do. So, before I introduce you all to our esteemed speaker for today's session, we would like you to have a brief introduction about Medlearn, what we are and what we do. I request Subhashi to kindly play the video for us.
Hospitals work round the clock to serve
Subhashi, can you
patients.
check the audio, please?
Being at the center of the action, hospital physicians
And play
and
it
staff
again.
must confront every situation and every challenge. They must also keep up with evolving health needs
Subhashi, there is
and
no audio.
knowledge through ongoing
Okay. Yeah.
In
Subhashi, please
today's
play again.
world, technology
Yeah,
is
yeah, it's audible.
Hospitals work round the clock to serve patients. Being at the center of the action, hospital physicians and staff must confront every situation and every challenge. They must also keep up with evolving health needs and knowledge through ongoing comprehensive training programs. What they need is a promising solution to ensure a continuous learning journey.
In today's world, technology is transforming life. Be it taxis, food delivery, everything we need is at our fingertips. Education is also going through a transformation, and we are at the forefront in the healthcare industry.
Medlearn is a comprehensive learning, training and skill development platform incubated at Impulsys in India for healthcare professionals to attain the right mix of content, learning and skills that help them throughout their career. The platform offers a wide variety of courses that enable hospitals to meet their employee training and development needs in areas of quality compliance, soft skills, and induction. The platform is designed in a way that it enables easy tracking of the real-time status of their learning progress. What's unique about this platform is that it's accessible anytime, anywhere, ensuring quality learning literally at your fingertips. Hospitals can now assign courses and track the competencies of users on specific topics with Medlearn's intelligent assessment tool, which gives them better administrative control. Its superior courseware helps hospitals provide standardized care and bridge skill gaps at every level in the organization. The healthcare professionals will also become more efficient and empowered when their learning journey progresses with ease and at their convenience. Let us unite to improve healthcare in India by spreading knowledge through technology. Medlearn, better prepared for better care.
Thank you, Subhashri. Before I request Dr. Annie to kindly introduce our speaker, there is an exciting news that I would like to share with everyone that Medlearn has received its investment from its global partners, that is American Heart Association and Lateral. This makes us the only training platform in India with deep expertise in healthcare. We are the only full stack training solution that's 100% dedicated to hospitals. And we look forward to building a strong relationship with all the healthcare providers, with hospitals for their learning and development interventions across India. So let's start the session. Dr. Annie, I would request you to kindly introduce our speaker for today's session, and then we can take it from there.
A very good afternoon. I'm honored and privileged to introduce my friend, Dr. Rangnath, for today's webinar. Dr. Rangnath, a radiation oncologist at HCG Curie City Cancer Center, Vijayawada. Having completed his MBBS in 2011 and post-graduation in Pune in 2016, Dr. Rangnath worked as a senior specialist resident in Cornell Medical College in 2016 to 17. He joined HCG Curie City Cancer Center in 2017 as a radiation oncologist and is well versed with advanced treatment techniques, conventional, 3D CRT, IMRT, VMAT, IGRT, SRS, and SRT. He has experience treating over 3,000 patients to date and has handled over 2,000 brachytherapy cases. He is also a member of Association of Radiation Oncologists of India and European Society for Medical Oncology. Dr. Raghunath, thank you so much for your valuable time. Over to Varun.
On behalf of entire Medland team, Dr. Rangnath, we welcome you and thank you so much for agreeing to do this. So I'll tell you how we are going to plan this. First, we gonna go through your expertise and what deep insights you have for us on the cancer, and post that we will have a session on Q&A. So people can drop in their questions, their suggestions, their experiences, anything they want to ask you, and we'll have a quick 10 minutes Q&A after your session. So over to you, sir. Thank you.
Yeah. I'm audible, right? Voice is good and clear?
Yes, yes, you're audible.
Nice to meet everyone. It's interesting to know about Medlar actually. I'm new to this. Thanks to Annie for giving me this chance to share my work also with you guys. So I'll share the presentation. Give me a minute. I hope my presentation is visible, right?
Sir, you're audible,
One
but
second,
this,
1 second.
yeah.
1 second. Is it visible right now? Is it visible?
Yeah, it's visible now.
Yeah. Sure. Before we start the presentation, actually, few things I actually thought like to discuss before we start. Um it's good that what you're doing is really good. Interesting that you are actually educating the doctors and other people regarding the medical education. Uh, Basically, the problem that comes with cancer is like started off with see. First, let me introduce myself properly. So, I am Dr. Ranganath. I'm a consultant radiation oncologist. I did my post graduation from Pune in 2015. Then I worked in a few hospitals. Then I came back to Vijayawada. This is my native place. So I'm working in HCJ from last say around 6-7 years. So actually, Annie has actually told me regarding this program actually. So my major intention of picking up this topic is like I want to give a insight into what actually people think of cancer and what is the reality. And the second thing is like the problem that we oncologists face regularly with our patients. These are the things actually we want to cover. So let's start. As Annie has introduced, there's no point of talking again. But the one thing I want to especially think is like basically oncology requires a lot of time and practice experience to actually know about what actually we do. So it took me a lot of time actually to study this and understand what we actually going through and what is the life of a patient and what exactly a patient of cancer will go through. So I'll try to give a lot of insights into the practical world and the reality that people suffer and a lot of myths that regular people hear about this and what are other options people usually consider instead of going for allopathy. See, the key points that we are going to discuss today is why cancer is the leading cause of death. You know why it is so, and is cancer really curable? Can we prevent these cancers, and what is the success of these existing treatments? And is Indian treatment at par with Western medicine? So these are the main focus points. So coming to the starting question, what is cancer? Basically, this is the question I actually ask a lot of people. So, what do you know about cancer? What is cancer? What causes cancer? What is the link between genes? How it can be prevented? See, the problem is like, everybody knows something about cancer. Everybody knows, it is a dangerous disease. It is like a dreaded disease. People will die because of cancer. There's no cure for cancer. People don't want to even tell to other people that they had cancers. And some people, in the part of me, this is a tier 2 city actually. So in tier 2 and tier 3 cities, the problem is like, they don't even want to tell people the word cancer because they think that cancer is almost equal to the HIV and AIDS because they try to think that people will discriminate them, they try to dishearten them, and they even motivate them not to go for anything else. So this is the problem of cancer. But if you see the book definition, what is cancer is simple one word answer is that anytime our body is tuned to uh, be like this and our cells are tuned to behave like this. So when any of your behavior, any of your cells behave uncontrollably and grows beyond a certain proportion and it disturbs our regular work. So for example, if a cell of lung actually works in such a way that it has to breathe in and breathe out, when this is working differently to what it actually has to do, then the problem comes. So this is the problem in cancer. So, lot of questions, and these are the common questions that I face every day in our regular OP work. So, when the people comes to me, the attenders, the patient relatives, and the patient themselves will ask me these questions. Uh, is cancer equal to death, or is the cancer is communicable, or is that my family has to worry that they will get the cancer because of some problem? So, and the last question is that I heard that some of the patients got treated and it didn't work out. So these are the common questions that every oncologist have to listen in their regular practice. So I'll tell you, see why it is one of the dangerous disease and why it requires a lot of motivation, lot of we have to preach this and we have to educate people and including doctors, regular public, everyone, because this is a major slide I want to show. This is ICMR data of recent one. So if you see the cancer statistics in India, the number of people actually living with the disease is around 27 lakhs. And if you see every year, we are around having around 14 lakhs, the registered patients. The same presentation I have given before, I think around 3, 4 years back. And the old slide that I have is every year the new cancer patients are around 7.5 lakhs. So I had to change the data for this new presentation. So if you see from the last 4 years, the number is actually doubled. So the data that was there before 5 years is around 7 lakhs every year the cancer patients. Now it is 14 lakhs. So, and if you see the number of deaths are almost equal to more than half. So 8.5 lakh patients are dying because of cancer every year in India. That is more than half the diagnosis. So if you go in depth about the most common cancers, you see every 8 minutes a woman dies because of a cervical cancer. And every two patients of breast cancer will die because of breast cancer. So these figures are actually very startling and these are very concerning to everyone. And even if you see in depth, the recent tobacco awareness, the tobacco related deaths are around 3,500 per day. And if you don't believe it, the tobacco has caused close to 3.2 lakh deaths in 2018 only. So these are the data that have been took from ICMR. So this shows that the burden on the society is very high, and cancer is really going to trouble a lot of people. So this is the reason for the main concern. And why people die of cancer? The second most common question: why people die of cancer? The major problem lies is, I'll try to explain you in further slides what is the stage of disease, why, how we do staging. But basically, what happens is most of the patients present to us in early stage, advanced stages. So, lot of patients that come to me, they come in the late stage, that is the stage 3 and stage 4. This is a common presentation for us in regular OP. And the major problem is we have to convince the patient for the treatment. The thing is, they have a lot of fear factors. The thing, like for example, surgery is going to cause this problem to me, chemotherapy is going to cause this problem to me, radiotherapy is going to cause this problem to me. They have these superimposed ideas in their brain, which they come with these ideas to our hospitals. So they have this fear, innate fear, which they have from a long time because of their surround societies and friends and everyone. So the fear of treatment is one thing where people will deny the therapy. And the next one thing is, people usually choose the alternate treatment. See, whenever they try to come to us, we explain, for example, a patient of breast cancer come to us, we explain them, it's a long therapy, we have to go with surgery, followed by chemotherapy, followed by radiation therapy. When we explain them all these things, they want an easier option. They'll ask us, can you give a tablet where it will cure the cancer? Can you give me a syrup which will cure the cancer? You will say obviously no. So then they will think of alternate treatments like other therapies where I don't want to name few, but I had to name like something like people who follow Shimoga medicines and they follow Ayurvedic homeopathy, where they give some pills which are not actually FDA approved or which are not approved in any other countries. They take these therapies for some time, and when they fail in those therapies, they come to us and they will ask for the our treatments. So all these factors will actually cause us the delay in therapy, and which will eventually result in the dying of cancers, which will actually prolong the patient, which will push the patient to death. So these are the major reasons actually. So if you see the major burden in the society right now in India is the four diseases. That is the cardiovascular disease, the diabetes, the respiratory problems, and the cancer. And fortunately, all these things are non-communicable disease. It won't spread from one patient to one patient like COVID. So that is a good thing actually. That's why our survival is good. But the thing is, these diseases actually account to close to 60% of Indian population. 60% of Indian population actually suffer with one of these diseases. So these are the major burden in the society. So, and coming to the cancer treatment, so I'll try to brief you with what actually we do in treatment of cancer. See, basically, cancer therapy is a multi-modality treatment. That means multiple departments work together to treat the patient. It is not like other treatments, like for example, you have a cardiac problem, you go to a cardiologist and they will do some stenting or they will do a bypass and will be free of the disease. And like for example, a gastric problem, you go to a gastric surgeon or gastroenterologist and you get relief from the symptoms. But oncology works differently. In cancer treatment, multiple departments have to come together for the cure. For example, it includes surgical oncologists, it includes medical oncologists, it includes radiation oncologists, it includes pathologists, radiologists. Lot of people have to come together, sit together, think, and then the treatment actually starts. So I'll give an example of some other treatment. Like for example, a patient came with a brain tumor. So how do we do a brain tumor patient? So initially, brain tumors are diagnosed by an imaging, like CT scan or MRI scans. We do a basic MRI scan. We diagnose a brain tumor by an MRI scan, and we take the help of radiologist. We ask them what are the findings that he found, and if he confirm that it's a tumor, we ask the neurosurgeons to operate the disease and remove the disease. And after the surgery, we ask for pathologists to grade the tumor. What is the grading of tumor? Is it a grade 1 tumor, grade 2 tumor, grade 3 tumor, or a grade 4 tumor? According to the grade of tumor, the stage of tumor, we decide the therapy. So, as you see, multiple departments have to work together step by step to achieve the cure. So, this is the basic thing in a cancer treatment. So, if you see how a normal cancer cell, normal cell behaves, and how a cancer cell behaves in the body. See, as you see, our normal cells have a destined life. It will divide to certain cells, and eventually it will stop grow or it will die eventually. That is the normal growth of a normal cell. So, but then what happens to a cancer cell usually? When a cancer cell attacks in the body, it kind of mutates. It mutates once, it mutates again, it mutates again, and after a certain bit of mutations, it eventually grows as a cancer. That's why if you see lot of cancer cells before they convert into cancer, we find a pre-malignant state, that is the pre-cancer state. So these are the pre-cancer states where we can actually diagnose a cancer and we can cure them before the cancer actually develops. So this is a cell division that happens in the body before a cancer actually grows into a full proposed cancer. So I'll try to show an example of a skin cancer, how it actually grows and how it actually becomes dangerous. See, uh, this is a melanoma actually, which is a skin cancer. It starts in a forearm or it starts in any part of the skin, and eventually over a period of time, if it is neglected, it travels into the blood. It goes to multiple organs, and it settles down in other organs like liver. It settles down in brain and even in the bones and other lymphatics. So what happens is the cancer actually travels to multiple organs and it affects the other organs also. See, for example, if we talk about cardiology, the heart problem basically affects the heart. So you will have a problem in the heart and you will get the therapy there done, and you will include only the heart. But cancer is, it includes multiple organs. It includes brain, it includes liver, it includes lungs, the bones, the blood vessels, the lymphatics. So it is a systemic disease basically. It can affect all the parts of the body. That's why it is very dangerous. If you don't treat it the right way, it will eventually kill the patient. So this is about the dangerousness of cancer and what actually causes cancer. See, if you see the cause of cancer, I try to put in a simple way here. See, basically, cancer is caused by hereditary, the diet, the hormones, the chemicals, virus, bacteria, and radiation. I'll try to give a small example so that it will make sense to you. See, hereditary is something like, all of you might be heard of it. Breast cancer, ovarian cancer, prostate cancer, all these cancers actually they travel in the genes. So they travel to one person to other person. That is the hereditary. It can be affected to a mother and it will be transferred to a child and to the other child. So that is the hereditary way how a cancer develops. But the good thing is not all cancers are hereditary. Only few cancers are hereditary, and that is a major reason because the certain genes in the body actually got mutated because of the cancer, and they behave altered after a certain amount of age, and they develop these cancers in their body. That is the hereditary way of developing a cancer. And coming to the diet, so if you see a lot of awareness actually happened in the Taiwan cities, certain foods if you eat, they're carcinogens. Like people try to educate everyone, this is a carcinogenic food, this is not a carcinogenic food, this can cause cancer, this doesn't cause cancer. So this is like the link between diet and cancer is established. Like certain foods like red meat and multiple times processed oils and trans fats, all these diets actually has a tendency to affect our GI system, that is the gastrointestinal system, and they have a chance of getting gastrointestinal cancers. So there the diet plays a major role. So coming to the hormones, so we have certain hormones in our body which will give us a shape and which will give us an identity. Like for example, if you see in females, there are something called estrogen receptors, progesterone receptors. These hormones actually make us what we are. Like females, the specific identities like long hair, the breast, and everything. So these hormones decide the position of the body. So basically, these hormones also are linked to cancers. Like for example, breast cancer is linked to hormones. Like few hormones actually cause breast cancer. The same way in males, there is something called a testosterone hormone. So this testosterone hormone, when it becomes uncontrolled, it can cause prostate cancer. So there is a link between hormones and cancer also. And coming to chemicals, there are a lot of chemicals like radon gas. There is like exposure chemicals like asbestos. All these chemicals can cause cancer. And radiation, as such, thankfully in India, we don't have radiation exposed cancers, but countries like Australia have the exposure of radiation is very high there because of the ozone depletion. And those people are actually having a high propensity of getting skin cancers. So these are the link between radiation and the cancers. And coming to viruses and cancer, see, if you people got educated a lot of things in recent times because of the COVID virus, but you won't believe 99% of cervical cancer is caused by a virus, that is the HPV virus. So viruses can cause cancer. If you want to know, it can cause cervical cancer, it can cause anal cancer, it can cause penile cancer, it can cause oropharyngeal cancers. So there are a lot of cancers it can cause, and EBV virus we call it. It can cause even nasopharyngeal cancers. So viruses can cause cancer. Bacteria can cause cancer in a different way. It is like, when a bacteria affects body, kind of like, it is called infection. And when it stays for some time, it's called chronic infection. These chronic infection periods sometimes can cause cancers. So these are the different ways how a cancer is developed in the body. So coming to the real world data, so I try to put in few cancers that are commonly seen in India. These are recent stats actually. So in men, if you see, the most common cancer is the head and neck cancers. That is the oral cancers, the neck cancers. And the second most common cancer is the lung cancer, followed by stomach and esophagus and the prostate cancer. If you see females, recently the data has been changed. Previously, we say the cervical cancer is the most common cancer, but right now the most common cancer is the breast cancer in females, followed by cervix, followed by ovary, and the last one is the head and neck cancers in females. These are the common cancers, and these account for almost 70 to 80% of the burden in the cancer society. So I try to put in a small slide here, which shows lot of common symptoms that can be linked to cancer. That is the signs and symptoms of cancer. See, basically, I try to sum it up in an easy way. These are the symptoms which can be linked to cancer, but don't imagine that all the symptoms are linked to cancer. See, the thing is, abnormal bleeding. See, whenever the patient has abnormal bleeding, it can be a cancer, but it is not necessary that all the patients who have vaginal bleeding is cancer. The problem is like, whenever there is a problem in a female that vaginal bleeding is there, discharge is there, the first thing to be done is like, observe and see how significant it is. If it is not getting relieved in few days, like a week or two, you should definitely consult a gynecologist or a specific doctor. And any bleeding that is recurrently coming to you and it is affecting to you, this definitely should be scanned and it should be thoroughly investigated. The same thing when it comes to breast changes. Breast changes are very common in females. As you age, the changes will be very predominant. But whenever you see a difference, I'll try to put in other slides also and show how it actually changes. So when you find a change which is definitely looking abnormal, definitely you have to consult a doctor. Any kind of abdomen pain which is persistent for a long time, which is not getting relieved, better to get it checked. And loss of appetite can be a cancer, but it is not definitely linked to cancer. It is one of the symptom of a cancer. Then I'll try to brush in few things about oral cancers because this is a major burden in the male society. Actually, a lot of people have these cancer problems and they don't know that this is cancer. It is like, see, I'll try to sum it up all these statements in a simple way. The thing is, oral cancer can be diagnosed easily. That is like, whenever you brush your teeth, try to observe your mouth carefully. So, how is your teeth? How is your tongue? How is your palate? How is your gingiva? How is your lips? How is your throat that you can see? So, whenever you see any ulcer or any lesion or anything that is looking different and it is not causing pain to you and it is bleeding, it is persistent for some time, there's a high chance that it can be a cancer. And whenever you have a history of smoking, alcohol, or any other tobacco, definitely it can be a cancer. So these are the symptoms and signs which can be correlated to cancer. And coming to the other major burden in the society, that is a lung cancer. See, these are the few of the symptoms that we see in the lung cancer patients. That is chronic cough. That is when you cough, blood will be coming, wheezing sound, chest pain, voice change, shortness of breath, weight loss. You're unable to do your daily activities. All these signs can be linked to lung cancer. But the common question that we've been asked is, these symptoms are seen in regular people. What does cough link to cancer always? No. The thing is, like, whenever you're getting a cough for some time, that is more than 2 weeks, the first thing you have to do is get an X-ray done. So a plain X-ray can help you diagnose a cancer. It can be infection, it can be just a pneumonia, it can be a bronchitis or asthma, it can be anything. But instead of thinking that it is normal, get it checked. And whenever you have a habit of smoking, definitely whenever you are coughing, whenever you have any symptom, it should be thoroughly investigated. So these are the symptoms and these are the signs and how we actually know that is a cancer. So I try to keep few of the information here. This holds true for whole cancers. See, how do you actually diagnose a cancer? Basically, when a patient comes to us for cancer, the first thing that we do is we try to examine the patient clinically to see how is the cancer. So whenever we get an idea of what it is, we'll try to do a basic workup of cancer. That is like, do a X-ray, do a ultrasound or CT scan, MRI scan. PET-CT scan is something that recently we are doing. That is a full body scan, which gives a information that the patient has a cancer or doesn't have a cancer. So these are the different ways how we check whether a patient has cancer. Then once we get this imaging test done, that the cancer is there or no, then we go for lab test. That is like, we take a biopsy, we take a tissue, or we take a FNAC, that's a small needle test, to find out whether a patient has a cancer or no. So all these tests are must to diagnose a cancer, and these tests are important to stratify a cancer and to treat a cancer eventually. So the major part of today's topic is the treatment. This is kind of elaborative. I don't want to take a lot of time here, but I try to give a gist of it, what exactly happens in oncology. See, basically, when a patient is diagnosed with cancer, the patient has to undergo some sort of surgery or radiation chemotherapy. So I'll try to explain you in certain way. It will make a sense to you. See, surgery is one of the most common way of removing a surgery. I mean, removing a cancer. Like, say, for example, as you are aware that during your childhood, like 1980s, 1990s, you happen to see a lot of patients undergoing radical surgeries, like for example, radical mastectomy, that is removal of the whole breast, removal of tongue, removal of limbs, that is hand, leg, or removal of a body part. It's very common those days, because the notion at that time is, when you have cancer, remove the part, you'll be free of cancer. That is the ancient way of thinking of in oncology. But recently, what actually happened, with the development of cancer, we try to preserve the organs. That is called organ preservations. Like, for example, a patient comes with a breast cancer. We don't want to remove the whole breast. Instead, we try to do a small surgery. That is, I'll try to show the image. This is one way how a breast surgery is being done in old age. That is, when a patient has a breast cancer, this patient has a left breast cancer, and you see the whole of the breast is removed here. This is a modified radical mastectomy, we call it. That is, remove the whole breast, remove the muscle as well, and remove the cancer itself. This is one way of treating cancer, and this is being followed by some surgeons even now. But if you see, recently what happened is, when a patient has a small cancer in the breast, instead of removing the whole breast, we try to remove a small portion of the breast. That is called wild local excision. So here our intention is to remove a small part of breast so that the patient retains her breast and she will feel like a normal person. The problem with cancer therapy is, like, once the patient is finished the treatment, most of them can't undergo to their normal lives. They have this social stigma and they have these concerns. They have this tragedy in their brain. They are afraid to go to public. They try to, limit to home. They don't want to face public. They don't want to talk to anyone. They don't want to go to their jobs because people will discriminate them. They try to demotivate them. They try to look them down. So that's why our intention is, like, to give them normal life as much as possible. That's why, to give them their identity back. That's why these breast conservation surgeries have actually come up. So this is the trend in recent surgery. That is preservation of the organ and thus giving a better life to the people. And coming to the chemotherapy, I'll try to give it a simple way. Chemotherapy is, in a simple way, if I have to explain, it is a form of therapy that is given to the whole body. That is, we give it in a form of injection to intravenous. That is a vein, we give the injection, and the drug actually travels to the whole body and it gives the desired therapy. For example, a patient of breast cancer comes to us. So we give 3 sets of injection to them in 3 weekly manner. That is, we admit the patient in a daycare. If you happen to see certain movies, like all these movies, I can't remember actually. So a lot of movies when you see, they try to show a cancer patient to you. They show that their hair is gone. They go to a daycare center where they'll be the recliner. They'll give injections continuously. That is how chemotherapy is actually given. We give a set of injections to them in a 3 weekly manner or 2 weekly manner or weekly manner as a limited amount of doses in a particular amount of cycles. The intention of chemotherapy is we want to give the medicine to the whole body so that if the cancer is spread to multiple organs, we want to treat it multiple organs at the same time. So if you see surgery, radiation therapy, it is a local therapies. We give to a certain small body part only. But chemotherapy, we usually give it in a systemic way. That is when a cancer is spread to all the organs, the major form of therapy is chemotherapy. But recently, as advancement has happened, we are giving chemotherapy in tablet forms also. That is like, for example, temozolomide, capecitabine. These are different drugs actually. So we give the same desired chemo injection result by tablet form. So there are different ways of giving injections or tablets. So all these are summed up in a chemotherapy. Coming to radiation therapy, I am a core radiation oncologist. I'm practicing this thing. So the problem is like lot of doctors, lot of specialists, lot of MBBS doctors, lot of doctors itself. I am saying is because nobody actually knows about radiation therapy or anything because our MBBS knowledge or MBBS curriculum doesn't have a cancer as a subject, and we don't have a syllabus on cancer. We don't have a designated curriculum or training in cancer. So people doesn't really know about anything about cancer, and they don't even know anything about radiation therapy. Whenever they come to a doctor, whenever even doctors when they refer a patient to us, they don't even know what actually we do. So basically, I want to give a brief idea to you. Radiation therapy is a form of cancer that includes 70 to 70% of all the cancer patients in some sort of stage, like stage 1, stage 2, stage 4, any stage. So we give it in the form of X-rays. That is through this kind of machines. These are our machines, and this through this machine we place the patient on this bed, and we kind of give the treatment through this machine. So this is a one way of giving radiation therapy, and it is just like a CT scan machine or MRI machine where we treat the patient using X-rays, which we can't see, and this happen in a course of regularly over a period of 5 to 6 weeks. So this is what is teletherapy. So this is one of our patient. I'm trying to show it in a symbolic way. When a patient comes with a head and neck cancer, we'll try to place the cancer in the patient in a certain position. We keep a mask for them. We keep this mask so that the patient doesn't move during the therapy. And this is similar mask. This is being kept to a patient. This is a patient of pelvic cancer. This is kept so that the patient doesn't move during the therapy. And we try to demarcate the cancer from the surrounding structures. This is the cancer sites. So we treat this cancer in a different way. This is one way how we are treating cancer. I don't want to go into the depth of this. It can be boring. So this is different ways how we treat the cancer. So this is all the radiation therapy outside the body. And coming to the internal way. See, this is like brachytherapy. That is giving radiation into the body. That is, this is an example of cervical cancer. If we observe closely, the patient has a cervical disease here. We try to keep these applicators into the uterus. This is the uterus. So we keep into our female body, into the uterus, and we connect the radiation machine to this, and then we give the radiation to the surrounding organs only. This is called brachytherapy. This is the brachytherapy equipment. And this is one sort of therapy that we give for esophageal cancers, that is intraocular brachytherapy. So this is all about radiation therapy. So this sums up the major therapies that we do regularly. And I want to add some therapy to you, that is the immunotherapy. If you people know about this, or if you are interested to know about this, immunotherapy is one interesting way of treating cancer. That is like, if you know, for example, if you catch a cold, if you get cough, if you get fever, our own body will produce the immune cells, and those immune cells will fight against the disease, like for example, cough, bacteria, virus, or fungus for that matter. Our own body is creating the immunity and fighting against the disease. But what we do is we try to give sorry, antibiotics to it, we give antivirals to supplement the therapy for us. So the same thing what we do is immunotherapy. Immunotherapy is nothing but we trigger our immune system to fight against cancer. That is modulating our immune cells to fight against cancer. I'll try to show you a small interesting photo. So see, this is a T cell. That is the T lymphocytic cell, which will target the tumor and which will kill the tumor. Okay, but the thing what happens is the tumor cells are very clever. They're very adaptive. You know what it does is it will create certain information to the body cells that we are good cells here. Please don't kill us. So it will give a certain information to the T cells. See, if you see here, it is tumor cells is triggering a small molecule and it is making the T cell to turn off. So basically, the thing is, it is saying to the body that we are a normal cell here. Don't fight against us. So this is one way how a tumor cell will try to make our body cells to think that they are normal to the body. Don't kill them. But what immunotherapy does is like it we actually give certain drugs to the body. What we do is we prevent our tumor cells uh, to mimic them or to try to demotivate them or to deactivate them. So thus the T cells will fight against the cancer. So if you see here, we give a certain drug to the body which will bind to the T cell. That is the T helper cells, T immunocells. So all these cells will be activated by these cells, and then these cells will fight against the cancer. That is immunotherapy. So if you want to know, immunotherapy is a recent science. It has started from last 20, 30 years, but the recent advancement happened in last 5 to 10 years. If you see, these are the few molecules, that is nivolumab, pembrolizumab. All these drugs are used in the last stage of cancers. If you want to know in depth about this, these drugs are very costly. If you want to know, these costs around close to a lakh or two per month. So time will tell us, and time will decide the cost of these drugs. If you see some example, I'll try to give. There is a drug called palbociclib. If you happen to Google it after you go home, palbociclib is a drug which is given in a metastatic breast cancer, which is being diagnosed before 5 years. When it started in the market, it came to a price of 1 lakh for a course of 1 month. So a lot of patients were not affordable for that. And eventually in 2023, the cost of drug is 3,500 rupees. So from 1 lakh, it has been brought down to 3,500 rupees. So in that way, coming years, all these things will make practical sense and it will make the cancer therapy in a much better way. So uh, I try to summarize a lot of therapies here. The major thing I want to convey here is, all these therapies actually made the cancer patient's life much better. So I'll try to show the sample cases so you will understand what is a cancer and how it is actually spreads. So this is one of the tongue cancer. You see, this is the cancer that is present in the tongue, and this tongue cancer has a tendency to spread to the lymph nodes in the neck. So this is a advanced stage tongue cancer which is spread to all the lymph nodes. So this is how the patient comes to us. So what we do is we try to operate this tumor. So if you see the tongue cancer, we try to remove a part of the jawbone, that is the mandible bone, and we try to do the surgery. So I'll try to show how the surgery is being done also. So then a example case of lung cancer. And as I told you, a sample X-ray can diagnose a lung cancer. A normal X-ray can show a lung mass, which can be eventually diagnosed to a cancer. So I hope I am audible, and I'm trying to play a video here. And I think whether if everyone is sleeping or whether active, please try to watch this video, and I'll tell the reason why I actually played this video also. Please watch the complete video. And all those who smoke, you have definitely watched this one. Okay. try to forward it a bit.
Well, if you smoke, I hope this gives you the incentive.
See, basically, after watching the video, I mean, whoever actually watched it, see, the thing is like, a cigarette actually is it has around 150 carcinogens in it. Okay, so every bit you smoke, it travels through your throat, through your mouth, it goes through the trachea, it goes into the bronchus, it goes into the lungs, and you won't believe it not just ends there. It even circulates in the body, it goes into the blood, it travels to all over the body, and it will leave a deposit to it. You won't believe, in all the cancers, right now the established cancer, lung cancer is caused because of smoking. And as much as if you take 100 lung cancer patients, almost 90% of them have a exposure of smoke. That is, whether they're directly smoking or they are taking the someone's exhalation, or if they are taking they're part of someone group or someone. The thing is that it kind of leaves the deposit in their body, and it causes a serious threat to society. So this video actually I found on internet, and it actually made a lot of sense. Once it goes into the body, how it leaves a part of it in the body, and how it actually blocks the complete pathway. So this is how dangerous it is. So when I actually worked in from last, it's been almost 10 years for me in this field actually. So before I came into this field, a lot of my friends actually they try to demotivate me not to go into oncology, because it includes a lot of trauma, a lot of death, and a lot of tragedy. But after traveling to almost a decade in this oncology, I happen to travel with a lot of oncology patients, a lot of cancer patients. They became part of our life actually. So when you see their lives, lot of patients have a lot of regrets in their life, lot of worries things. Like most of the patients actually tell me that they don't know it's a cancer. If they would have known it, they would have met me earlier. That's a common regret they're going to face. And second thing is they're going to say is, I have a lot of money. Please try to save me from this cancer. I can pay you how much ever you want. And the third thing is, lot of people might be thinking, you even lot of audience here will be thinking, cancer is a death symptom. Why do we actually have to spend money for treating it actually? See, I'll tell you a practical example of a patient that I treated. Uh, he actually got cancer, and he doesn't know that it's a cancer. The family is aware of it, and somehow through some staff he got to know that it's a cancer. So he actually, what he told me, like when he knows about this cancer and he has around a couple of months to live, He actually asked us, I have almost crores of money at my home. I'm going to pay how much ever you want. Please extend my life to more than 1 month. So that is the problem with cancer, that last moment of days when you have a expiry date for your own life, that every day is very valuable to you, and every day makes lot of difference to you. And then all these funda of movies, the favorite actors, favorite actresses, and all these imagination of smoking, the fantasy of smoking, the fantasy of drinking will actually go once you spend your time with a cancer patient, basically. So that is the reason for keeping that video. And our major intention is, when Annie actually asked me, also the major reason for me to join this is, you guys are promoting something, and cancer should be an active part of awareness, because it's a serious burden in the society. If you don't create awareness, people will die because of cancer, as simple as that. And the second thing is, you have to educate them about screening. How do we actually screen the cancers, so that you can diagnose it before it actually develops. And the third thing is, it has to be treated by a right specialist. We study countless of hours on the books, and it makes a lot of sense that we need to treat. So this is the thing about the awareness part. And I'll try to put in few screening modalities that we do. That includes, I think you might be knowing about it, the mammogram, the pap smear, the ultrasound scan, low dose CT, colonoscopy, endoscopy. See, I'll try to summarize it faster. Mammogram is basically used to diagnose a breast cancer. I kept a photo here. This is a mammogram machine, and we try to keep the breast here, and we try to check the whether the patient has a breast cancer or no, or whether she has any sort of breast problems. And this is how we get an image, like whether the patient has a breast lesion or which she doesn't have anything. So it's a very, very safe test that can be done to all the females after a age that is around 40-45 years. They have to get themselves checked. The patient who has cancer in their family has to be checked earlier to 10 years, that is 35 years to 35-40 years. So this is how we do a mammography. And I want all the females who are working there, and who are having their relatives, whoever your well wishers are, please try to see what is breast self examination. There is nothing like to be shy, or nothing like to be not aware of this. It's a normal thing. Whenever you take bath, try to examine your own breast in different postures, and try to check with the you know keep your four fingers, and use these four fingers to check your breast completely in a circular motion. And you do it like weekly once, or prior to your periods, or keep a routine and check it every day, I mean, or at least weekly once. You will definitely try to know your own body, and you can diagnose cancer yourself, basically. And this is a cervical pap smear. This is one way how we check a cervical cancer. That is, we use a small spatula, we call it. We use this smear to check your cervical area, and we take a small tissue from there, and we see whether the patient has a cancer cells or no. This is a very simple process, a OPD process actually. It hardly takes 5 minutes time, and this can help us to know whether the patient has cervical cancer or no. Uh, See, we have talked about a lot of things about the diagnosing cancer, curing cancer, symptoms of cancer, treatment of cancer, and the life of smoking patient, everything. And as an oncologist, what is the success? What will we are we proud of, and what are we doing in reality? I'll try to show the success of our treatments. Basically, if you see, I try to put in a cervical cancer patient statistics here. If you see, cancer is staged in four, which is stage 1, stage 2, stage 3, and stage 4. So if you see, the stage 1 patient survival is almost close to 85 to 95%. See, if you see, almost more than 85% patients will live more than 5 years in stage 1. And if you see stage 2 cancers, more than 67% patients will live freely. That is like, out of 100 patients if you treat cancer, almost even 70%, 80% patients will win against cancer, and they will survive normally. But if you see the stage 4 thing, it is less than 20%. See, if you see, if the stage goes higher, that is stage 4, the chances of survival is very less. It comes down to drastically to less than 20%. That much of severity these cancers are. And I try to put in the breast cancer also. If you try to screen a cancer by mammography, you won't believe almost 100% of the patients will survive cancer before even diagnosis. And if it is in stage 1, 98% patients survive cancer. Stage 2, 93%. Stage 3, 72%. So if you see the starting 3 stages, patients don't die of cancer actually. More than 70% patients will live with cancer. The problem comes in stage 4 group. That is hardly 20% patients will live. This is the part of the thing that is actually troubling us, because most of the patients come to us in stage 3 and stage 4. And if you see the tragical cancer, that is, why did I keep the video? Is because of this. If you see lung cancer, the story is completely different here. The problem with lung cancer is, even in stage 2, when you diagnose a lung cancer, even hardly the survival is less than 30%. We can't even win lung cancer outright. That much danger it is. It travels faster and you can't diagnose it easier, and it eventually grows and kills you with cancer. That's why the best thing, the best norm of lung cancer is try to stay away from smoke. And whenever you have any problem, try to get a scan done and try to diagnose it as early as possible. Once if you see stage 4, the survival is 5%. That is, in 100 patients, hardly 90% patients will survive the cancer. That much dangerous lung cancer is. So I try to put in few things about breast cancer and cervical cancers to all your technical geniuses who are residing in Bangalore, Chennai, Hyderabad, and everyone, because the problem with there are two kinds of females actually. I don't want to generalize it, but I want to say it. The thing is, like, highly educated and non-educated females. Basically, I try to categorize it as rich females and poor females. The problem is, like, our society is changed in certain way where, we try to either over-educate or under-educate. The thing what happens is, when people of our grandmother age usually get married early, and they used to have a lot of children, and that is bad. We have a lot of awareness. That's why we say don't get married before 20 years or 25 years, 20, 18 years, something. But what happened is, our education has gone beyond a certain age. Our individuality has come up in such a way where people are not even getting married also. They're not getting married. They're staying single. They are saying it's our independence and everything. The problem that comes is, the breast cancer, the it will try to choose all those patients, all those persons who don't marry even after a certain amount of age. That is, they remain nulliparous, they don't breastfeed, the hereditary breast cancers. So these are the patients who are actually susceptible to breast cancer. But if you see the contrasting side of it, the cervical cancer is, it kind of affects the village people. That is, like, where you get married in a young age. That is less than 15 years, less than 14 years, 13 years, 14 years, 16 years. You get married early. You have multiple kids, 4, 5, 6, and you have multiple sexual partners, and you have low socioeconomic status. You don't go to a doctor. You don't show to a doctor. You have infection. You treat it yourself. You don't have a hygiene. So all these things will summarize the cervical cancer. So these are the symptoms, these are the causes for these two cancers, and which can be prevented actually. That's why I try to put in this slide here. So, and one more thing about lung cancer, people who all smoke actually know about this clearly. This is a gold flake cigarette packet, which looks like this. I think this is around 2000 years that time. I'm not actually new of it, but around 2000s, the cigarette packet actually looks like this. It looks very clean, with a photo of a person, with a diagram of lungs, and they don't really scare anyone. They show it in a very nice way, so people can smoke, and we get revenue. But right now, this is a recent photo. This is the future of cigarette packets, and these are the images that are going to be there on cigarette packets. Because I took this image from a government website, and this is going to start from 2022 December actually. So the printing is being going on. So we want to scare all the smokers in such a way that they don't want to smoke, because these are the images we are keeping right now in cigarette packets. If you people who smoke are really knowing about these images, because these scary photos are there in all the cigarette packets, because our intention is basically not to smoke. These are the reality. As an oncologist, I'm saying I have seen these kind of patients. So this is the reality, and this is the oral cancer propensity. If you diagnose it early, you have a good chance of living. If you diagnose it late, you have a very bad chance of living. So Everyone knows, everyone have been going to movies, everyone watches movies, everyone regularly sees movies, but how many actually see this female in the ad? And whenever I go to movie, I try to see people whenever this ad is being played, and I can say that 90% of them don't even see the ad properly because they try to see their phones or they talk to their friends, but try to see the video. This actually shows the journey of a female from diagnosis to treatment and the life of her. So I'll try to play this video.
मैंने कब
Please watch
सोचा
it.
था मेरी जिंदगी यूं बदल जाएगी। सब कुछ इतना अच्छा था, एक अच्छा पति, दो प्यारे बच्चे, लेकिन तंबाकू ने सब कुछ बदल दिया। अब इस फैलते हुए कैंसर को मेरे चेहरे से काटना पड़ेगा।
This is how we do
अब
surgeries.
कुछ भी पहले जैसा नहीं होगा। तंबाकू ने मेरी जिंदगी नष्ट कर दी।
खैनी, गुटखा, तंबाकू, जर्दा, पान मसाला आपका जीवन उजाड़ देते हैं।
And this is how really the patients stay like this. So coming to the end of the topic, so I want to conclude that preventable cancers are few cancers which we can prevent, that is lung cancer, cervical cancer, head and neck cancer, and all those virus related cancers where you can actually give vaccination. Like we have vaccines of HPV recently, so we can take these vaccines and we can prevent these cancers. When the cancers like cervical cancer and all these virus related cancers, and lung cancer, the prevention is only one thing: stop smoking and stop drinking. Head and neck cancers, stop tobacco and stop drinking. Cervical cancers, maintain a good hygiene and try to take HPV vaccine. As simple as that. So, as I kept in the beginning, what is the similarity between Indian versus Western data? Whatever we follow in India, thankfully, is the Western data actually. Our treatments are as per the Western standards. We use our standard American guidelines, European guidelines to treat our cancer patients. And the machines that we use are actually that are manufactured in Sweden, Germany, or US. And all the chemo drugs or all the drugs we actually use are from, they are either produced in US and they're manufactured in India, or they got imported to India and are using. And all the surgical expertise, the robotic surgeries, lab surgeries, and everything are like at par with US. So stop this funda that when a patient diagnosed with cancer, go to America and get it treated. Whatever happens in America happens in India. Whatever happens in UK happens in India. There's no point of traveling here and there for treatment. If he can't survive here, he can't survive there also. So I conclude this a small slide what actually we try to do, what my friends think I do, and what my mom thinks I do, and what society thinks I do. I try to give radiation to everyone, but and government thinks that we earn a lot of money. But what we really do is we try to sit in front of our systems. We do a lot of brainstorming exercises to treat our patients. And thank you so much for your patient hearing. And as a oncologist, I try to create a lot of awareness to my friends and my colleagues and my patients. I kept my own YouTube channel and my Facebook pages and Insta pages, so that I made regular videos and I try to create awareness, because the only way to cure cancer is to know about it and to try to prevent it. If you can't prevent it, at least diagnose it early and try to come out of the disease as early as possible. This is the reality of cancer. I want to share it with all of you. Thank you. And these are my pages. So whenever you are interested to know about it, try to share it and try to learn about this. And this is my hospital identity. So where I actually work. Over to the organizers. So please take it over.
Thank you so much, Dr. Rangnath. It was a very insightful session. I believe you were able to cover all the aspects from awareness to treatment to screening to bursting the myth. So I believe that was a very comprehensive session, and thank you so much for catering all the aspects of cancer, the categories of cancer. I believe, I'm sure this is going to benefit our audience. So to everyone who are present in today's session, we would be sharing you the YouTube link of the recording of today's session with you all. Also, we would be posting it on our LinkedIn pages, so you can go to Medlearn's LinkedIn page. Subhashi will put the LinkedIn link of Medlearn in the chat box. You can go to our LinkedIn page. You can follow us there, and you can get the video links of all the expert sessions that we conduct. Also, in case of any query, you want to get in touch with us regarding today's session, regarding MedLearn, about our platform services, about platform operations, our subject matter experts, you want to go through the demo, you can uh, uh, drop in your queries in info@medlearn.com. Let us quickly go to the Q&A and then we can wrap the session up. Can angiography and angioplasty lead to cancer, sir? There is a question.
Angioplasty and can you repeat it again?
Can you stop sharing the
Yeah,
PPT?
yeah. So, can you repeat the question,
Thank
please?
So there is a question in the chat box about can angiography and angioplasty
No,
lead to cancer? No, right?
no.
Okay. Another question is any prophylactic treatment for any of the cancer categories?
Actually, it's interesting. I want to keep a few photos for that, but you are all aware of Angelina Jolie, right?
Yeah.
So the problem with this thing, she is actually she's a genetically hereditary breast cancer is there to her mom and her grandmother. So she kind of underwent bilateral mastectomy, that is removal of the both breasts, and she removed her ovaries as well, and she got reconstructed by that. The problem is like you can't really actually keep on removing your organs that you might get a cancer. So there is nothing like anticipate a cancer and remove. So for example, all the screening modalities that I actually shown to you, for example, there's a breast cancer patient to a patient and her child has a 50% propensity of getting cancer, but that doesn't mean that the female the child which when she becomes elder, we don't really remove the breast and we don't remove the ovaries and we don't give such a life to her. The major intention is when she has a symptom, try to reach the right people. So in that way, we can diagnose it faster and we can give a better quality of life. So preventing cancers is good, but preventive surgeries are not good. And there's no such drugs like you take these drugs, you don't get cancers. All these multiple drugs have been tested, but nothing really made sense. But healthy habits are really good. Like curcumin is a good product, tomato is good product, and regular mixed diet is good. Don't take too much of carbs, don't take too much of fats, don't take too much of anything. We keep a regular routine of everything, keep a good exercise, and all these things can prevent cancers, but preventive surgeries are not at all good.
Okay. Sir, another question is, do the early signs of cancer vary in young patients and elderly patients?
No, actually it won't, because even a patient of breast cancer in an early stage, in a young age, will come with the same symptom, and elderly female also will come with the same symptom. So the symptoms won't change because of the age. But the thing is, like in certain females of like for example, when you're talking about cervical cancers, usually menstrual ladies usually have menses every month. So and patients after they attain an age of 45 or more than 50, the thing is, when after 45, whenever you are going into post-menopausal age, bleeding is a bad symptom, irrespective of whatever it is. One episode, two episodes, after 45, 47, after your post-menopausal, even a single episode of vaginal bleeding should be definitely checked. But a patient who is in a young age, like 30, 40, if she has a pervaginal bleeding, or if she has post-menopausal bleeding, or if she has pre-coital bleeding or post-coital bleeding, you don't need to really worry. You just observe it, and if your symptom is persistent and if you have some other symptoms, you can consult a doctor. So that is the only way where it actually changes.
Okay. So, sir, other than smoking, any lifestyle modifications you would suggest to sustain a cancer-free life?
See, you guys are doing from Bangalore, right? See, the problem with India right now is, we have problem of pollution, we have problem of smoking, alcohol, and Western diet, and sedentary habits, and all these things are cause of cancer basically. So try to have a healthy diet, try to abstain from all these habits. The problem is, smoking, I will tell you two patients, patient who just smokes and patient who smokes and drinks. The problem is, when you drink along with smoke, it actually amplifies your risk for cancer. So try to limit these things and try to avoid these things to have a healthy life.
Okay. Sir, another question is, can you throw some light on mental health and cancer, the
It's
relation between the
actually
two?
it's actually a long topic actually. Basically, see, I will tell you in a practical way. Patients who have a sound mental health will actually win cancer. How I want to show it is like, a patient who has a stage 4 cancer, who knows that they can survive cancer, will actually win cancer. I mean, in a different example, if you see a soldier and if you see a normal person, a soldier can be hit by multiple bullets, but he will fight against the enemy in a border. But but a person in our regular society, a single bullet will kill the patient. It will kill the person because the thing, our own mental health will win us cancers. A patient who has a strong mental health will any stage of cancer. The thing is, sound brain, sound mind, sound heart will definitely help in the better care.
Great. Sir, one last question. Before the age of 40 for females, which test do you suggest to assess breast cancer?
See, the for breast cancer, more than 35 years, if you are living in a, as I said, the high risk features, all those features, the best thing is to be done is mammogram. See, mammogram is a very safe test. It is being done in any part of the India. Ideally, I try to make it in a better way than US guidelines. You can do a mammogram in this year after 40 years, and after 1 year, try to do an ultrasound scan, and again after 1 year, try to do a mammogram. So you try to skip every year differently, so that you will have two different scans for a breast, and usually this mammogram and ultrasound scan is more than enough to diagnose any small bit of cancer, and both of them are safe, and these should be the major scans that should be done by most of the females who are above 40 years.
Okay. So, sir, thank you so much for addressing all the queries. I believe that's all with our Q&A, and I believe a lot of fans you are going to get on your channels, because I could see a lot of queries still there are. But great session, sir. Thank you so much, and we look forward to have similar sessions with you in future. And of course, this session will add up to the knowledge and skill base of all the members who have joined today. Thank you, sir, and thank you so much, everyone, for joining in for today's session. Stay tuned for more Medline expert webinars like this. And you can have all the details on our Medline website, on our LinkedIn page. You can also write to us on info@medline.com. So happy learning experience, everyone, and Medline team wishes you all a great evening ahead. Thank you.